I'm going to open up another series. We're working on another series of information. And it's really just to kind of have a conversation around healthcare. Certainly, we're coming into the fourth quarter. Everybody understands that healthcare is expensive. If anybody's had a private conversation with me, you know that I'm always frustrated with, the conversation where I show up at your office and I'm like, we have a 10% renewal this year. And we go through some market studies and some analysis. And, then I come back a couple weeks later and say, like, great news, now we're at 8%. And we've kind of become accustomed for this conversation of saying that that's okay. And, talking to our finance teams, our CFOs, and, understanding that, great, we have an now 8% increase. It's disproportionate to my large employers because the employees are probably capped on what they're paying. Or if it's not, and we're sharing it with them, then they have an 8% increase in their premiums, but potentially they got a 3.5% wage increase. And so there's an eroding effect. And everybody understands that. We've had multiple conversations. And so what we're doing is I'm going to put together kind of a 6-part series is probably the only word I can come up with. But it's really kind of hyper-focusing on some different strategies that we can be taking as employers to help, bend that curve. Because forever and a day, we have to somehow come up with solutions. It's not happening on a national level. There's programs that are available from local levels. And I just think it's a conversation we need to have. Is it going to be right for every employer? Probably not. Is it going to be right for 10%? I don't know. It's kind of a conversation where we're looking at, the early adopters and the ones that are, standing in line to get their iPhone right when it's issued versus the ones like Kathy, who my wife, who I think is still on the call. I'm wagering she still has an iPhone 6. And then it's everywhere that's in between. But the conversation is, let's talk about it. Let's talk about the ideas. Let's talk about the delivery of healthcare. Are there some different programs that we can use? And then you, from a leadership perspective, have the opportunity to make a decision. It might be 2021, it might be 2025, but at least let's get the information out to everybody so that you can start making decisions and start learning of different tools that are available without disrupting care, because that's the biggest thing. We've coined a new word called underinsurance in our industry. And the reason why we now have a word called underinsurance is because one of the strategies that we've all employed, and it's just not here at Arcwood, it's, I'm on the ledge team of the Arizona Association of Health Underwriters, and we've got 350 guys like me in the membership, and it's the same conversation that we're all having at these roundtables. And it's, as the premiums go up, there's disproportionate sharing with the employer. We can't continue to do that. So then we increase the out-of-pocket exposure to the participants. And so now it's become unaffordable. If you look at most of the bankruptcies that are happening from healthcare and non-payment of bills, a lot of it is from individuals that actually have coverage. So we have to start having conversations on how we're going to start bending this curve and taking a different approach. And so this is going to be the 6-point series. They're each going to probably be lasting about an hour to maybe hour and a half. And my goal is to really have a conversation, showcase some different things, talk about it, have kind of open dialogue, depending upon how many folks want to join on. So look for these invitations as they come out, because I think it'll be something that, just at least from a knowledge perspective, is that we just want to make sure that we're sharing this with you. With that, I want to thank you again for your participation today. Next town hall is scheduled for the 28th, 2 weeks from today. Maybe we'll have a CARES, maybe not, but I know we're going to have enough information that we're going to help share with you. I know Diana and Matt and again, David, you've been willing to share some information as well. So we'll definitely have a town hall 2 weeks from now. If you have any questions, ping us. Our sequence is first name @arcwood.com, and then you got Matt's information up there. David, I realize I didn't put your information up there, so I apologize. So I'll route any questions through myself or Diana, because we certainly know how to get a hold of you. And with that, thanks everybody. I appreciate your time. Have a great week, and we'll talk soon.